You will find that you intervene and interact with clients at different stages of readiness. You will also interact with clients at various stages of health and wellness, such as those who are at elevated or high risk for disease based on lifestyle factors or their behaviors. You'll have plenty of opportunities to coach clients who are apparently healthy and simply want to stay that way. But this will mean that you need to be able to assess your client through both observation and through physical means. Your assessments will produce results that influence the decisions made between you and your client. While it might be obvious for either you or the client to know of what specific behavior changes are needed to improve wellness, your assessments might reveal even more that require exploration. Some of these items might be priorities, requiring immediate attention, whereas others will be side effects of the change process or lower on the scale of priorities. Effective wellness coaching will require that you factor all of this into strategies and then to involve your client in the process of improving their wellness using a client-centered approach. We have emphasized the structure of a one-on-one approach with wellness coaching, but we also want to encourage a more client-centered approach whereby the client determines what changes need to be made in order to improve their overall wellness. Remember that many of your clients will be working with the wellness coach for the first time, or they may have had different wellness coaching services in the past. Regardless, the wellness coach represents a solid anchor point for the client and provides strength and comfort in the face of the uncharted territory of behavior change in clients who have not made attempts before to change risky or unwanted behaviors. When you are aware of what clients are looking for from a wellness coach, you are delivering your service from a client-centered approach because you are considering what the client looks for from within you. This is the only way that we can work with the client to efficiently achieve wellness goals. When you have determined your client's priorities, you provide several positive reinforcers for the coaching process while keeping the process client-centered. Part of taking a client-centered approach means that we have to understand what's important to our client. We use what we call the importance ruler to assess this from our client. Although this might seem like a simple process, it requires that the coach persuade or help the client to clarify their values or those things that seem to be important from within their mindset. With evolved listening skills, reflection, and motivational interviewing, you'll be able to see those areas of focus that your client believes are priorities, or in other words, those that are important. One of the biggest challenges to being a wellness coach is to help clients manage busy or very active lifestyles. Sometimes this sort of lifestyle creates a more sedentary activity profile seen in our clients' activity levels or physical fitness. We have described methods to help clients change behaviors, but we have not really described the specific physical changes in terms of improving our clients' fitness levels to impact their wellness. When you first meet with the client, you have to understand that they may be using your service because they have had a health scare or a warning sign. Timing becomes important for a client in this scenario because we can still move through the behavior change process efficiently enough to prevent the escalation of warning signs. We coach clients with health concerns every day. It's typical for a client to retain a wellness coach after some sort of a warning sign related to their health, but how we work with these clients depends on many factors. The level of intensity of our coaching interactions is sometimes based on how we assess our client's current state of health and wellness. For a client who has a known disease, prevention efforts are not going to be effective because that opportunity has come and gone. Therefore, we have an obligation to focus on behaviors from the client that are seen to be more risky or contraindicated. If you should find yourself coaching the client who has been diagnosed with a chronic disease or condition, they are already working with the medical professional. This requires that you understand that your role in the coaching process becomes one of managing directives from the medical professionals, and in this way can be viewed as a lifestyle prescription. The best strategies for a coach working with a client who's been diagnosed with a chronic disease or condition include balancing the demands of self-care. This involves finding out from your client what they would like to focus on as a behavior change related to their lifestyle and condition. Remember, we will assess our client using observation and physical assessments, but we also want to know what the client feels is a priority for change. Once you have the groundwork mapped out, it's time to ask the client to commit to the small steps toward an end goal of improving their wellness. We have described biometric assessments for your client in Part 5. With the results of these assessments, you will be able to determine what the needs of your client are as opposed to what the client's wants are. Needs and wants are two different things. A client may say that they want to lose weight, but we know that they will need to do certain things in order to do that. We also need to assess why our client is making a step toward changing something in their health or wellness. Remember that we use those listening for skills to do this. We need to be able to clarify goals with the client, but for the process to be effective, we also need to know what motivates and inspires the client to make these changes at this point in time. Physical assessments cannot be substituted in terms of their relevance, impact, or importance to you. But when you can use a health risk assessment with your client, it will provide the client with more useful information about their health and wellness. HRAs, or health risk assessments, are commonly used to gauge where a client sees themselves relevant to various wellness indicators. This will include typically both emotional and physical markers. HRAs use a self-scoring system whereby the client ranks how they feel about certain areas of focus, ranging from alcohol intake to sleep and anything else in between. Because the information is completed by the client, it reveals their perspectives about their current state of wellness. HRAs are structured to encourage honesty and confidentiality. In this manner, your client's priorities are revealed as well as perspectives about current health and wellness status and willingness to change. By itself, the aging process provides coaches with challenges that arise from conditions seen in those who you coach. Many times, our clients simply accept the aches and pains or changes to their functionality as part of the aging process. This perspective is something that can be changed within the client's mindset by understanding their history and then coaching some of the specific values or beliefs from within the client. But what about physical conditions that are revealed upon your first point of contact? It might be useful for you to understand that some of your clients will be part of what is known as a special population. While all of our clients are special, those in special populations are those considered to have chronic conditions or diseases that they are currently managing. Sometimes clients enter into this group after a medical professional has diagnosed a condition or disease based on symptoms. For these clients, again, prevention efforts are off the table. Your role then becomes one of simply facilitating as much normal function as possible for this client. You'll always be surprised by how much a client can do, even when they have been ranked as being part of a special population. This will require strong coaching skills and a full understanding of your client's past history and their current state of health. Like we've mentioned, clients very easily buy into the aging process and believe that there's very little that they can do to prevent the onset of feeling old or fighting off the negative consequences of being complacent about their health with advanced age. If your client has come to you with a medical diagnosis, you are working with someone who has established a relationship with a medical professional, and if your level of credential is below that of this allied or health professional working with your client, you must be mindful of the limits that you are under. This will affect the level of intensity during the coaching interactions. For some, you'll be simply helping them to manage conditions or their disease. A great example is a diabetic client who you follow up with based on directives from their endocrinologist. When you work with a client who has needs outside of your scope or expertise or field, you must get a medical clearance in order to move forward. In general, it's safe to follow ACSM guidelines and terms for how we intervene with clients and work with them toward facilitating healthy behaviors. Throughout this course, we have mentioned several conditions or physical states that require improvements from our client who's willing to make such changes. We've also mentioned that there are many different types of clients and situations, but typically health concerns are driven by a few main or key indicators. Also very common are those clients who present with obesity and or stress. We will round out Part 7 by discussing strategies to better understand and coach clients who are either obese or stressed. Remember that the two are not mutually exclusive and in fact may be seen tied to other conditions that require behavior change from your client. Think of it this way, you are establishing some priorities and stress or obesity can be considered priorities for behavior change as they are also far-reaching and the wellness profile of our client is affected by their status if they are at risk. Obesity is defined in Chapter 5 and confirmed from the coach through assessment. Always remember to stay consistent with the client-centered approach. You must learn from the client what their perspectives and motivations are as they relate to body weight and body image. More information on understanding this is provided in your manual. Once you have biometric readings from your client, you can then use the science of facts to persuade behavior change. It's pretty unlikely that you'll find just one stress management process that will work for every client that you coach. The best and maybe most important process of managing stress is to prevent the negative side effects to the client before they become unmanageable. Your goal is not to overcome every stressor that your client faces, but instead to help them effectively manage their responses. Ideally, this would be something that you aim to prevent from happening in the first place by identifying barriers and obstacles that may cause stress during the process of strategizing toward behavior goals. Because stress has different effects on everyone and each client has a different perspective about stress, it's essential to view each client from an individual perspective in order to stay client-centered. More information on strategies to coach your client through stress are provided in your manual. Our mission has been to provide you with the complete experience in terms of preparing you to be a wellness coach. No matter what our intention is, your decision to absorb this information and to practically apply it falls upon your abilities to stay client-centered and effective in every coaching interaction that you provide. This requires that you know all the different components of wellness coaching, but the irony of this is that you may feel you will never know all the components required to meet the needs of every client that you meet. The only guarantee that we can provide you is that you will be challenged by what your clients present to you. Staying on point with the structure provided and the suggestions for facilitating behavior change will help you to conquer both physical and emotional wellness factors seen from your client. We encourage you to use creativity in strategizing with your client. This is the only way to encourage the successful evolution of the wellness coach profession.